I feel I can better care for my patients because of my training with SPS. I went through the Revenue Directed Hygiene training with SPS about 4 months ago. I'll admit I was skeptical when I was first told they were coming in for training because we've been through training companies before, and I really don't feel that I got a lot out of those companies in the past. But with SPS it was different. I think a lot of it had to do with the fact that I was working with other hygienists, and I just think that we understood each other and we knew where each other were coming from, and I was, I think, a little more comfortable with them and opening up to them about what my concerns were. So I just think that going through this particular training, they concentrated a lot more on what I needed, which was working directly with my patients, improving my communication skills, and basically just helping me treat my patients better. I think the DISC element was really good because I've been through, as they call them, social styles or personality styles of patients, and I think the one that SPS offered was just really basic and easy to understand, and I think it made it easier to categorize the patients a lot easier. I really didn't have to think about it. I mean, the cues were right there. I mean, I didn't have to really try to figure it out too hard. It was pretty obvious. I feel that I've improved my communication skills with my patients quite a bit. I feel that one of the biggest things I personally took from the training is the ability to deal with that difficult patient and not stumbling or feeling insecure. I think that my confidence level has gone up, and I think that I'm able to explain things better to patients, which I think in turn makes the patients more agreeable to treatment. I would recommend SPS to colleagues just based on the way that it was able to improve my communication skills with my patients. Again, I have new patients coming in who really don't seem to have the information about periodontal health or anything, and they're coming from other dental offices. These aren't patients that haven't been to a dentist, and I feel there's a lot of offices out there that could benefit from their training, just based on what I've seen with new patients coming in, that they're really not aware of periodontal disease or recession or any of these concerns. And I think that with SPS, if they were to come into an office where they may not be providing the best patient care, I think SPS could train them and get them back on track, and they would be treating their patients better.